I think we can get started, and participants will be able to join, and they'll see the screen we're currently sharing right now. But again, thank you all for joining us. We are Alzheimer's Los Angeles, and thank you for joining us for our virtual speaker series at the forefront of combating inequity. Just a reminder for all of you to please mute yourselves if you haven't already. Please hold your questions. We will be answering questions using the chat feature. So if you go to the chat box in Zoom, you'll be able to type a question that you can type and share with everyone, or you can send to me as the host, and I'll be happy to share with our speakers. We will be recording the session this afternoon, so we will be able to share the video recording as well as the slides to everyone that participated. So thank you again for joining us. My name is Melly Khamvongsa, and I am the VP of Development for Alzheimer's Los Angeles. I want to talk to you a little bit about our organization. As you may know, we are a 501c3 nonprofit organization, and our mission is improving the lives of local families affected by Alzheimer's and dementia by increasing awareness, delivering effective programs and services, and providing compassionate support and advocating for quality care and a cure. So I'm very proud to be a part of this organization and a team that has really seamlessly pivoted to providing online and virtual services for our clients. We're really excited to launch this free summer speaker series to our community. This is the first time we've done something like this, so our hope is to be a resource for you and to answer all of your questions, and again, direct you to those services that are available. Again, after our speakers finish, we'll be able to share our contact information with you as well as our website. And as I mentioned earlier, we will be recording the topic, and we will email out the recording as well as the slides, which do contain some links that Dr. Deborah and Barbara will share. So I just wanted to go ahead and say this is the third of our topics. The first topic we had about 3 weeks ago was caregiving in crisis. Last week, we talked about health inequities in our local communities. And so today's topic, we will be talking about advocating for change and protecting our vulnerable community. We are going to be hearing both national and local perspectives from my two colleagues that I would now like to introduce. So first, we have Dr. Debra Cherry. Dr. Cherry is a clinical psychologist and the executive vice president of Alzheimer's Los Angeles, a community-based nonprofit dedicated to supporting people with dementia and their caregivers. She is a Phi Beta Kappa graduate of Brooklyn College and then completed her PhD in clinical psychology at the University of Southern California. She went on to complete a postdoctoral fellowship in geriatric psychology at UCLA's Neuropsychiatric Institute. And Albert, if you wouldn't mind going to the slide with our speakers' names. Thank you so much. Throughout her career, Dr. Cherry's work has focused on improving access to dementia care for underserved ethnic communities and on improving dementia healthcare. She has published numerous articles on this work and is a contributing author of California's evidence-based guideline for Alzheimer's disease management, a practice guideline for primary care providers. She serves on several advisory bodies, including the NAPA Advisory Council on Alzheimer's Research, Caring Services, and the State of California Alzheimer's Disease and Related Disorders Advisory Council. She is a past recipient of the Rosalind Carter Leadership and Caregiving Award, granted to recognize an individual for leadership and innovation in caregiving. Next, I'd like to introduce Barbara McLendon. Barbara has a deep background in public policy. For the past 15 years, she has focused on aging and long-term care policy and advocacy in her position as the Public Policy Director at Alzheimer's Los Angeles. During this time, she has developed legislation and policy recommendations to improve services and support for people with dementia and their families. She is a regular participant in the state's Alzheimer's Advisory Committee and has provided comment in response to many state initiatives, such as the recent CalAIM project. Early in her career, she worked as a legislative aide in the Texas State Legislature and served as a policy analyst for the Texas Sunset Advisory Commission, where her work focused on improving the delivery of social services to both children and older adults. She subsequently served as the public policy director for the Texas Council on Family Violence, where she lobbied for legislation and funding to support victims of domestic violence. Her current projects include advocating for the development of dementia-capable healthcare delivery systems and building dementia-friendly communities in and around the Los Angeles area through Purposeful Aging Los Angeles. So thank you again, Dr. Debra Cherry and Barbara, for joining us this afternoon. We're so excited to hear and learn more. And now I'd like to hand this off to Dr. Debra Cherry. Thank you.
Thank you very much, Melly. And if we could move to the next slide. It's a pleasure to be here today, and I really appreciate the focus on this very important topic. I thought I would answer the question first about why do we advocate? And I have to say that there are plenty of reasons to advocate. In the world of dementia, we advocate because we're very concerned that families are being driven into bankruptcy simply because they want to care for a loved one with Alzheimer's disease or related dementia. The government can do something about that. We advocate because too few people with cognitive impairment ever get a diagnosis or the appropriate care that they deserve. We advocate because people who provide care to older adults are undervalued, are underpaid, and untrained. So it's no surprise when they leave off doing this care to go work for McDonald's because they have a better quality of life providing that kind of care. We advocate because in emergencies like the one that we are currently experiencing, people with dementia are disproportionately affected. And we advocate because the science around brain health is advancing, but the public's unaware that there's anything they can do to preserve their cognitive function. And finally, we advocate in the hope that through federal funding, we can find a cure, a meaningful treatment, or better care for people living with Alzheimer's disease or related disorder. The federal government has the capacity to change these important issues, but they won't if we don't advocate. Next slide, please. I thought it might be interesting to see how we advocate. We advocate as members of a variety of coalitions. Us Against Alzheimer's is one of those coalitions, and they have affiliates including Latinos Against Alzheimer's, African Americans Against Alzheimer's, Women Against Alzheimer's. And we are active in all of these coalitions, as well as the LEAD coalition, Leaders Engaged in Alzheimer's Disease. And we do this because in conjunction with other organizations, we are more powerful. Our voice is amplified. We also advocate through participating in advisory councils. And I've been fortunate enough for the last 3 years to serve on the Federal National Alzheimer's Project Act Council on Alzheimer's Research, Care, and Services. And this is a council charged with overseeing our nation's Alzheimer's plan. And it advises Congress and federal agencies on how to do a better job of serving the population we care about, people living with ADRD, which is short for Alzheimer's, and related dementias or related disorders, and caregivers. We provide comment on federal regulations and policies, and my colleague Barbara McLendon has been superb in doing this. And some examples are, why should the Center for Medicare and Medicaid pay more to providers, to physicians, when they provide dementia care? Many providers have 7 minutes to have a session with a family or an individual, but they need 45 minutes to do an explanation of a diagnosis of dementia care. So we provide comment on why that might happen, or why neurological research can better serve how neurological research can better serve people from diverse ethnic groups. And then finally, and most importantly, we advocate through people who sign up to be advocates with us. We activate our advocates with email alerts, take people to Washington and elsewhere. And you'll hear more about that from my colleague, Barbara McLendon. Can we flip to the next slide, please? Let me go through a bit about the specific topics we are advocating about these days, and actually for a very long time. And start with the issue of family impoverishment. When people provide care for people with Alzheimer's disease or related disorder, they usually come into it thinking that Medicare, the provider of care for people, health care for people as they get older, is going to help them out and pay for some of this care, and that is not the case. Most of the care provided through home and the community, and even in many nursing homes, is provided out of pocket by families. And so many families are forced to spend down all that they have spent their lifetime saving until they may qualify for Medi-Cal, which is health insurance for the poor. Medi-Cal, for some people, does pay for home and community-based supports and for nursing home care. And that's a problem, that families should have to spend down to almost poverty or to poverty in order to have some support for long-term care services. Caregiving also disproportionately consumes the wealth of African Americans and Latinx caregivers. And if you look at generational accumulation of wealth, it is less for those two populations. And so when they are in the position of providing care at home, the costs of the care at home is the same, but there's less of a base of wealth to draw down from in the providing of that care. So out-of-pocket costs are a huge part of what it takes to pay for people, and there are things that can be done at the federal level. For example, we could pass better family medical leave programs and acts so that people who are caring for someone with dementia get to leave their work without the fear that they're going to also leave their jobs, or that people with caring for a sibling are not excluded, which is the case in the current law. We can try to advocate for tax credits for caregivers so that their loss, the amount of money that they are putting into the care can be excluded from their costs of their income tax. We can ask for an expansion of the current federal funding for home and community-based services, which is now only offered to the very poor through Medi-Cal, but perhaps could be offered to people with a slightly higher income level. And then we also can advocate for federal coverage or state coverage of long-term care. Long-term care insurance is now a private purchase, primarily a private purchase market, and it is a shrinking market, unfortunately. Yet people definitely need long-term care insurance if over the course of a lifetime, much more likely to need that than life insurance. And it can help prevent impoverishment. Move on to the next slide, please. We advocate to address disparities in access to quality care. People, as most of you probably know, people with dementia are very underdiagnosed. Only about 50% of people with Alzheimer's disease get a formal diagnosis, and about half of those have it put in their charts. And as a result of not getting a good diagnosis, people seldom get access to the valuable care and services they need, things like disease education, caregiver training, support groups. They just don't get connected to that. And as bad as this is for everyone, the barriers are especially challenging for people from some diverse racial and ethnic groups, particularly people who are lower income or speak English as a second language, or face discrimination in accessing healthcare because there are no appropriate services in their communities, or no services that are culturally appropriate for them. So what are some of those solutions? I always give an example, and this is something that, you know, federal guidelines can do something about. If a person, when I was diagnosed temporarily and wrongly with diabetes, within a day, I was sent to a diabetes health educator. When a person gets a diagnosis of dementia, if they are lucky enough to get that diagnosis, pretty much nothing happens. They might be told, come back in 6 months, we'll see how you're doing. Or the family may be told, there's really nothing we can do, you should start thinking about a nursing home. Now that is wrong. There is plenty that can be done, and there should be better integration between a person's medical care, that moment of diagnosis, and even before a moment of diagnosis, and home care. So there is no reason why people who have who are making those diagnoses and people who are working with them cannot connect people to organizations like Alzheimer's LA or provide on-site disease education themselves. We can advocate with the federal government to put in guidelines that suggest that strengthen that possibility. We can advocate with them to do more workforce training so that our federal workforce, physicians to home care workers, know more about how to diagnose and care for people with dementia. We advocate so that proven interventions, these are interventions for caregivers or for people with dementia that have been shown to decrease patient or caregiver depression, anxiety, lower the likelihood of people going into nursing homes. We would like the federal government to make those interventions more readily available. And if a healthcare system is willing to offer that intervention, why isn't Medicare paying for it? It actually saves the money in the long run, especially if it can keep people out of nursing homes. We also want to make sure in our advocacy at the federal level that care planning includes the perspective of the person living with ADRD and of their family. Care planning is often done by healthcare providers to meet their own needs, instead of asking what really matters to this patient. Maybe it's that they want to be mobile enough to go to a grandchild's graduation. Maybe that's more important to them than that they get adjusted to a new medication. It has to be prioritized. Their voice should go into their care planning. And that is something that CMS is able to provide guidance to providers about, and we advocate for them to do that. Could we turn to the next slide, please? I spoke a little bit about the direct care workforce. There is a real shortage in numbers of people to provide care in the home, and that shortage is only going to get worse because our population is aging. So the demand is rising, but the people who do this work are undervalued and underpaid. You see some of this issue really coming to a head during the current COVID crisis, where you have people who are afraid to stay home from work in nursing homes because they don't have sick leave, or they're afraid they're going to lose their jobs. So perhaps they go to work even when they're not feeling that well. People in the direct workforce and direct care workforce do need training in dementia care, and they also need adequate compensation. And some of the solutions on the federal level are to work with HRSA, which is a federal agency that provides education and that can provide educational curriculum for direct care workers. And they can also do funding so that community-based organizations can do better training of the direct care workforce. We also want to work with various federal agencies and with Congress to advocate for improved salaries, for career ladders for this workforce, and for benefits for these workers, because if this is not seen as a valuable job, then we are not going to have quality people stick with it. They're going to move on. They're going to take that fast food job that offers them a few pennies more, and and if they're lucky, benefits and sick leave. Moving on to the next one, emergency response. The next slide. People with dementia, as we see now, are extremely vulnerable during emergencies, be they Hurricane Katrina type emergency, a fire, a wildfire in Paradise, or the current COVID crisis. An estimated half of nursing home residents are people living with Alzheimer's disease or a related disorder. They're extremely vulnerable. They are, during this pandemic, they are kept isolated from their families. They are confused by people wearing masks at all times. They don't understand why they have to stay in their rooms. They frequently leave their rooms. There is from the tales I've been hearing, there's a surge in behavioral symptoms of the disease because people are with dementia in nursing homes are frightened and really cannot understand what's going on. And again, the staff is also at great risk during these emergencies, be it hurricanes or COVID-19. And there are sadly statistics that suggest that nursing homes located in African American and Latinx communities are having even greater rates of the current COVID virus spreading, which is horrible. So some of the solutions that we advocate for are, and these are not in a particular order, but we have been advocating for FEMA, the Federal Emergency Management Administration, and the Department of Justice to develop training for first responders so they know how to react when they see someone who they suspect is cognitively impaired. We've been advocating with the Center for Medicare and Medicaid and with the VA to encourage them to update provider regulations, because there are regulations that will ensure that providers do a better job of isolating people who are sick, distributing protective gear, preserving beds. When a family takes a relative home from a nursing home because of the current COVID crisis, their bed is not preserved for their loved one's return, making it even harder for that family to make that decision to take the person out of the facility. There are regulations that can be changed, policies that can be changed that we advocate for to try to be protective of the people, living in long-term care facilities. There are also policies that we push for people living at home, and one of these is that there be advanced planning done so that if a primary caregiver becomes ill, there is a plan in place about who can take over the care of a loved one. These documents can be distributed by the Aging Services Network, and funding for that can be distributed from the Administration for Community Living or CMS, so that it happens and people are not left with no support at all. Next slide, please. We also have a great need for more education of the public about brain health. The problems here really highlight some of the healthcare disparities in our society. African Americans are about 2 times as likely as Caucasians to get Alzheimer's disease or related dementia, particularly vascular dementia. And people think that that is related to higher levels of hypertension. Latinos are about 2.5 times likely to get Alzheimer's disease or related dementia. And that is, people tie that in part to high levels of diabetes. Yet education is limited out there for all people, and even more limited for people from diverse ethnic groups about what the science is saying about how we can reduce our risk for these terrible disorders. There are solutions for this, again, at the federal level and at other levels as well, but my job is to talk to you about the federal level. We advocate for federal agencies to do a better job of researching social determinants of health outcomes. Why is it that African Americans, for example, have twice the risk? We can't always just assume we're right. There has to be research done to help us understand that. We also advocate for a public health approach and an infrastructure to better deal with this disorder. And when I I tell the story of first time I visited the California Department of Public Health. I was in a huge room full of desks, and I asked what it was, and they said, that's the cancer control section. I went, ooh. Then I went into another huge room, lots of desks, and I said, and where are we now? And this is the diabetes control section. And then I said, so where are my colleagues in the Alzheimer's program? And there was a corner office with 2 desks. And that was the Alzheimer's program. And it's largely because public health focuses primarily on prevention and has not enough knowledge about how prevention and risk reduction can be applied to issues of Alzheimer's disease and of vascular dementia. So we advocate for better education of public health personnel and better education of healthcare workforce in general, so that this large personnel out there, these people, these professionals, can educate the public. When a person is told that they have dementia, they should also be told about what they can do to maximize their cognitive impairment at this point in their lives, and how they can prevent unnecessary degeneration. Next slide, please. Finally, our advocacy is for better support of Alzheimer's research and Alzheimer's and related dementia research into a cure, into treatment, and into care for the disease. On the upper right, you see a small bar graph that shows the increase in funding for Alzheimer's research since 2013. And this is a very prevalent disorder. It is nationally the 6th leading cause of death, but there's no cure or very effective treatment. And in fact, for many years, funding for Alzheimer's research was stuck at about $500 million, whereas if you looked at AIDS research, diabetes research, cancer research, they were at $2, $4, and $8 billion. This was a very underfunded area. And happily, since the passage of the National Alzheimer's Project Act, the creation of a National Alzheimer's Plan, and the putting in place of the NAPA Council, what we are seeing is a steady growth in funding for research that Alzheimer's LA plays a role in advocating for. And we also advocate for inclusion of racially and ethnically diverse people in research trials. There are many reasons why populations are underrepresented, which I won't go into now, but we advocate for there to be funding for research that works in diverse communities. And we also advocate for recruitment and training of professionals who are researchers, who come from those communities and who might break down some of the barriers and make this research participation more accessible. So I'm going to stop here. This is a very high-level overview of our federal advocacy. I'd like to turn to the next slide and turn the presentation over to my colleague, Barbara McLendon, who is a fabulous advocate and our Director of Public Policy. Barbara.
Thank you, Deborah. I am very pleased to take over and talk with you all today about our state and local advocacy work. So I will start in the same place that Deborah started, which is not to assume that it's obvious why we would advocate at the state and local level. So why do we do it? It mirrors in many ways what Deborah spoke about why do we advocate at the federal level. Again, we are really focused on funding for services and supports our families depend on. Sometimes when the federal government puts a new program in place and puts money towards it, they say to the states, we'll give this to you if you match it, or if you contribute some percentage of the funding to make it happen. So we don't get the money at all if the state doesn't put forward some money in the first place. So we advocate for them to take those opportunities. And then there are other programs that state wholly funds. And so we are always closely watching the budget here in California. We want to have an impact on legislation. This is both a proactive and reactive process for us. We work with our care counselors, we listen to our families and pull forward ideas that we think need addressing through state legislation. And so we seek sponsors. Last year, it was a local San Gabriel Valley legislator, Assemblymember Ed Chow, that carried a piece of legislation for us related to the training that our emergency responders get around dementia. And that came straight out of the community that we serve, who was telling us about some very unfortunate incidences with emergency responders who were inappropriately asking the person for dementia to tell them all the information they needed about what had happened to them, and pushing that caregiver to the side when they tried to step in and explain the situation. So we put forward legislation to address that. Sometimes we also have to put forward a position that says this legislation would be bad for our families, and here's why. We also want to have an impact on the development and or regulation of programs that serve people living with the dementia or their caregivers. Again, when the federal government passes legislation or puts forward money, they often then leave it to the states to figure out what that's actually going to look and feel like on the ground. So these may seem like very dry, very weedy conversations, but it's important that we're in there, because otherwise policies, procedures, rules are going to be put in place that make no sense for our families. And that might happen not because someone is intentional about it, but because they do not know our families like we know our families. And so we advocate to try and impact that process. And then finally, the priority setting that happens all the time at the state level and the local level. And I'm going to speak about a number of initiatives that are currently underway that are all about laying out what the priorities for the state and or the county or city of Los Angeles are going to be when it comes to serving older adults generally, and then specifically our families. Next slide. Can I get them? Thank you. How do we do it? Again, as Deborah spoke about, we work in coalition. It's so important to do that because it does amplify our voice. We partner with sister organizations, Alzheimer's Orange County and Alzheimer's San Diego, to form the Southern California Public Policy Coalition. And so that work is wholly focused on Alzheimer's related dementias and our caregivers. But we also participate in even larger coalitions. And the next three that are listed there are all very large coalitions that are include other organizations that serve older adults, or in the last bullet, Care for All, any organization in California that's connected into the healthcare issue in any way. That has been very top of mind for us because, as Deborah said, we know there's a lot of unmet need out there, and that we have a healthcare system that's not always responsive and understanding of the needs of our families. We participate in the state's Alzheimer's Advisory Council. You might have heard this when Deborah was introduced. She is actually a sitting member of that advisory committee, and then I attend all of these meetings as well. And the purpose of that group is to provide guidance to the Secretary of Health and Human Services and ultimately the governor about what his priorities should be, what actions he should take to better meet the needs of our families. Just as at the federal level, we provide comment on state regulations and policies. Again, seems like it's so dry, but honestly, that old saying, the devil's in the details, is very true. And so we wade deep into those details and provide feedback, guidance, and recommendations. Some of my favorite days are when I've sent off public comment and then an email is in my inbox from the state saying, we received your comment and we want to talk about it with you in greater detail. We want to know more. And once we're in that dialogue with them, now we have an opportunity to really influence the decisions that they make, which will ultimately impact our families. And then finally, as Deborah mentioned, it's the activation of our advocates. If you are here with us this afternoon and you are not already an Alzheimer's LA advocate, our final slide is going to show you where you can take the steps so that you can become that. And if you are an advocate, you're going to get emails from us that will give you the background of the situation that might be the most critical and give you some tips on what you can say and how you can communicate with your elected officials. And we always have actions on our website. So I do encourage you to regularly look at the advocacy page of our website. It's going to give you the latest and greatest about what is top of mind for us. And then if you feel so inclined, what you can do about it. Next slide. So again, if you are one of our advocates, then this topic will not be new to you because you will have been receiving emails about the state of our budget since May. Back in January, the old world that we all used to live in, the state budget for California actually looked really strong. We were, for the first time in many years, talking about some exciting new programs that we might want to embark on, how we could expand and build and meet unmet needs. It was really exciting. And then COVID came. And the situation changed dramatically. And again, it is probably not news to any of you that we are now facing a really significant challenge when it comes to our state budget. So when the governor first looked at this and said, okay, different world than we used to be in, how am I going to fill the budget hole? Well, unfortunately, the place that he started with were a whole bunch of services that our families rely on. So his revised budget in May proposed eliminating the funding for a program called Community-Based Adult Services, which actually, who even knows what that is, right? But that name relates to adult daycare. So places where if you're a working caregiver, you can take your loved one with dementia, they can be in a congregate, safe setting for the day, they can get fed, they get activities, and then you can still work. So he was proposing total elimination of state funding for that program. He was also proposing total elimination of the funding for the Multi-Purpose Senior Services Program, which provides respite and transportation services and meals and home modifications. He also proposed significant cuts to in-home supportive services. So these are folks who come into the home to provide help, cuts to their hours. He proposed cuts to nutrition services, to the Caregiver Resource Center, and sort of unbelievably to the long-term care ombudsman. These are the folks that go into nursing facilities when there's a problem. They are the advocates side by side with families. And so it was just extraordinary to us that he was proposing these cuts at the exact moment when we needed to both help families be able to keep their loved ones at home and out of the congregate settings like nursing homes where COVID was ravaging the population. And we needed to have a strong advocate for families while this was happening, not taking funding away from that ombudsman program. So we built a coalition. We actually built with 10 organizations across the state. We reached out to all of our advocates. We spoke loudly and with one voice to our legislators and said, this cannot happen. And I'm happy to report that it did not happen. Because we pushed, because we were organized, the legislature said to the governor, we aren't choosing this space in our budget to fill the hole. And so the final budget that passed actually maintained funding for all of those programs. Next slide. Remember before when I talked about priority setting, there are two initiatives happening right now that's really what it's all about. And so the first is something called the California Master Plan on Aging. And this group, which started working last fall, was really about how do we do a better job holistically. You can see from the goals that are listed here on the screen, talking about services and supports and health and well-being and economic security. How do we do a better job serving our older adults? Can we go next slide? The bottom of this screen has a link there where you can click on that and really get into the details of what's in that master plan on aging as it stands right now. But for our conversation today, I wanted to focus on a slice of that. And that is the one related to long-term services and supports, because this is what our families rely on in order to keep their loved one in the setting that they want to remain in, which despite what many people think, if you have a dementia or a cognitive impairment, you have to go straight into a nursing facility. The vast majority of people who are living with a dementia remain in their homes and communities for a very long time. And they do that because they've got services and supports around them that help their families keep them safe at home. So we have been advocating for a system that all Californians can easily navigate and that you have access to those services in every community, which is absolutely not the case here in California. So here we are in Los Angeles. We do have, because we are in a city, access to a lot of the different kinds of services, but it doesn't mean you can figure out how to navigate them. This is what takes a lot of our care counselors' times, our helpline calls, because families don't know what's out there. And even if they have somewhat of an idea of it, they have no idea how to figure out whether they're eligible and how to manage that process. And so that's part of what we help families to do. But it should be a whole lot easier for everyone to be able to do that. And then Deborah spoke about highly valued, high quality workforce. We advocated for that within our state master plan on aging as well. And then that it be linguistically and culturally appropriate services, no matter what care setting you find yourself in. Next slide. Okay, so here we are, the second, running parallel to the Master Plan on Aging process, is the Governor's Alzheimer's Prevention and Preparedness Task Force. This idea actually started with former First Lady Maria Shriver. Those of you who know her may know that her father, Sergeant Shriver, actually passed away with Alzheimer's disease. So this is a cause near and dear to her heart. And again, the world we used to live in pre-COVID was an exciting one where we were saying, you know what, now is the time. Let's do a better job serving these families. And so she and the governor partnered to put together this Prevention and Preparedness Task Force with the idea that it would produce recommendations on how the state could do a better job. Now, Debra Cherry, whom you just heard from prior to me, was actually invited to be a part of a number of the meetings related to this task force. And we have been providing feedback to them just as we've done with the Master Plan on Aging. Now, this task force has been focusing on very similar areas: caregiver education and support, workforce training and retention, the cost of long-term services and supports, and healthcare inequalities. And we have been providing feedback, for example, on the cost of long-term services and supports, where we are urging this task force to make recommendations that are bold and aggressive. We're saying, take a look at what the state of Washington is doing and the proposal that they have put forward and have begun implementing that will actually give everyone who's a resident of Washington a long-term care benefit that gives them enough money to actually cover the kinds of services to the level that our families need. And so we want to see those kinds of recommendations, those kinds of priorities in both the state Master Plan on Aging and in the governor's Alzheimer's Prevention and Preparedness Task Force. Now, both of these initiatives actually made the decision in the midst of the craziness of COVID to combine their recommendations. So we hope, the plan is that by December, end of this year, there will be one report that will combine the recommendations of the Master Plan on Aging and the Alzheimer's Task Force. And so we will continue to weigh in and comment, and in Deborah's case, actually be able to be in real dialogue in real time about what the priorities should be that are included in these plans. And so on the bottom of this screen, you'll also see another link so that you can actually take a look and get into more detail about the work that this Alzheimer's Task Force has been doing. Can I get next slide? Okay, so that's a bit about what we do at the state level, but what does our advocacy look and feel like here in Los Angeles? A lot of our work is really predicated on the concept of building a dementia-friendly community. And what does that mean? So there's a graphic on the slide, and I apologize if it's tiny print and hard to see. So if it is for you, you're gonna have to just trust me when I tell you that what that represents is all of the different sectors of a community that a person with dementia and their family interacts with. We talk a lot about the healthcare space because it's so critical that we get it right. But we know that that's not the only sector of our society that our families interact with. We go to the bank, we go to the grocery store, we want to go to church, we are out, we need to take maybe public transportation, the bus or the metro. And we want ultimately here in Los Angeles to have everyone be living in a place where they are interacting with all of these different systems, and the people that are parts of those systems understand what their needs are and are able to make the kinds of changes and supports that allow those families to continue to meaningfully engage and to feel comfortable, welcomed, supported out in their communities. Because what happens all too often, unfortunately, for a lot of families when dementia becomes a presence is they kind of close in, right? Not sure where to get those services and supports. Maybe it gets too hard to navigate going to the grocery store, so they just, maybe church gets too hard and they start closing in. That's not what we want our families to, that's not the path we want them on. We want them to stay engaged because they have value and because they have lessons to teach us and so much joy that is still there. And we want to help them be able to maintain that. So what does that look like here in Los Angeles? What is dementia-friendly community work? Can we go to the next slide? While there are a lot of local smaller initiatives, the biggest one that we're a part of is something called Purposeful Aging Los Angeles. And there is, again, another link. And I know these slides are going to be sent to everyone so that you'll be able to click on these links when you get them. And there's a lot there. If you go to that link where you can see the conversations that we've been a part of, but this is Los Angeles City and County, which is terrific that they're all on the same page. And we are all working together to try to build a community where everyone can age well. Next slide. So this work is centered around what they call livability domains. We actually participate in 5 of these work groups, but I want to focus on only 3 of them for our conversation here today. Again, you can go to the link on the previous slide if you really want to drill down into these other areas. They're all really interesting, the work that's being done, but I'll focus here on these 3 that are highlighted. So the first, community support and health services, this is very much in our wheelhouse. This is what we do a lot of, right? This trying to make our healthcare systems more dementia friendly. What does that look and feel like here? Well, LA County Department of Health, that health system is huge and serves a lot of people. And so there's real potential to try to help that system become more dementia capable. For example, as they've been looking at reworking their electronic medical record system, we've been talking with them about, hey, can there be a component of that so that if someone gets a dementia diagnosis, automatically the local resources for that individual will pop up. So this speaks directly to what Deborah was talking about people with a diagnosis of dementia getting nothing and then, just told, come back in 6 months and we'll see how you're doing. If we were able to implement something like this, then they don't get nothing when they get that diagnosis. They get a list of local supports. Next slide. When it comes to emergency response and resilience, the process of the Purposeful Aging Initiative came together with a real tragedy that occurred to one of our local families. And you may have, be familiar with this story, but Nancy Polikas, a woman with early onset Alzheimer's, wandered away from her family at LACMA. And as that family was working with local law enforcement, local elected officials, trying to find her, they said to themselves, this system doesn't work and it has got to do a better job. And so they went to their County Board of Supervisors representative, which is Janice Hahn, and said that this has got to be better. And she said, you're right. And so we embarked upon a process of improving how all of these different systems, law enforcement, a big part of it, could do a better job when someone with dementia wanders away from their family. And so one of the outcomes through the Purposeful Aging Initiative was the creation of a program called LA Found. Again, another link where you can get more information. And if you go to that website, you'll see it's got all kinds of information about various tracking technologies. There is one specifically a radio frequency wristband that the LA Found program provides. And that enables a loved one who goes missing who has that wristband, the family can call 911, say my loved one's a part of the LA Found program, and then law enforcement can actually turn on their devices to the frequency of that loved one's wristband. So it's not like people are being tracked at all times. It only gets turned on when someone goes missing, but so far they have had 100% success rate. Our organization has been very involved to try to make sure that the program is responsive and works and makes sense and is easy to use for our families. That's a process whenever you have a new program, but the county has been really interested in partnering with us, which if you go to their website, you will know that because a whole bunch of our materials are on it. So our caregiver tip sheets and all of that kind of information is there because one of the other main focuses for LA Found is trying to be a one-stop shop for county resources. So families don't have to be so confused about where they can go to get help. And then finally, emergency coordination. So again, that our law enforcement and emergency responders need to do a better job so that they can find people more quickly. When someone wanders, time is of the essence. That is the one thing that we know for certain. And so this effort has been, like I said, very successful and has had tremendous success in helping our families connect to those resources. Next slide. And then the last area I wanted to highlight of our local dementia-friendly work is in the social participation and respect, social inclusion domain. The Purposeful Aging Initiative included the recommendation that the City and County of Los Angeles implement the Dementia Friends program. And we at Alzheimer's Los Angeles are actually the state lead for the program. And what it's designed to do is to give people a greater understanding of what dementia is, some tips on how to communicate. And then when you take the Dementia Friends session, you participate in it, we ask you at the end to actually take an action to make your community around you more dementia friendly. This can be something as small as my neighbor, I know my neighbor's living with a cognitive impairment, and I'm going to commit to going over there once a week and sitting with her. And so, or it could be big. I want to start a Dementia Friends initiative in my town, or anything in between. Right now we have about 1,000 people who are Dementia Friends in LA County, more than 3,000 across Los Angeles. Can we go to the, or I mean across California, can we go to the next slide? And if you go to our website, you can find out how you can become a dementia friend, and then you can watch these very cool videos that the mayor and all 5 of the county board of supervisors did to promote the program and encourage people to become dementia friends themselves. So next slide, my last slide. Can we go to the next one? Okay, so if you are not already an Alzheimer's LA advocate, I very much hope that your time with us this afternoon has encouraged you to become one. If that's the case, again, you can click on the link on this screen and you can sign up. Once you're signed up, you're going to get those emails that I spoke of. Whenever there is urgent action needed, it's going to give you everything you need in order to be able to take the action. It's really easy, I promise you. In many cases, all we ask you to do is send an email. Maybe we'll ask you to make a phone call. Excuse me. We also provide opportunities, again, back in the old world, and I hope again someday when we are out of this pandemic, to lobby in person, both in Washington, D.C. and Sacramento. And there are opportunities to advocate locally, because it is through all of our advocates that we put a face on the disease, that we make it personal for our elected officials. And once we've made it personal for them, that's when we can really move them to action. And I will stop there, I think, so we have time for questions.
Great. Thank you so much, Barbara and Deborah, for all of the amazing information you shared with us. I think there's so much great data and information that pertains, to the national and the local level. But I think for an organization like ours, like Alzheimer's Los Angeles, it's so important and so valuable to see all of those resources and information that is available to our local community. So thank you so much. We do have a few questions that I'd like to ask, and if anyone has questions, please type them in the chat box. The first one for Barbara, are scholarships for LA Friends still available?
Yes, they are. So you should contact our organization, and we will connect you up. Our care counselors help families navigate that whole process of signing people up. It's gotten a whole lot easier than it was in the beginning. And yes, scholarships are still available.
Wonderful, thank you. Dr. Cherry, you mentioned that it's a challenge to get an Alzheimer's diagnosis and even harder to get it documented in a medical chart. Can you elaborate on why that's a challenge and why that's such a problem?
I think it's a complicated issue. I think some of it has to do with nihilism amongst our healthcare professionals. They feel like, oh, I'm going to give this person a diagnosis and there's nothing I can do for them. So why would I bother to give them this additional pain? That gets even worse, actually, in certain cultural groups where not only do they think they can't do anything for them, but they feel that the diagnosis is a punishment or a negative that they've now burdened the family with. Other reasons are some providers are reluctant to make the diagnosis because then they must notify the local public health authority about the person's diagnosis, which can require them to come in and take another driving test. Doesn't take away your license, but it can require you to get a driving test. And then on top of that, a diagnosis of Alzheimer's disease is not as simple as taking a blood draw. Maybe it will be one day. It is a complicated diagnosis to make. It's a diagnosis of exclusion. And as a result, many providers don't feel capable of making that type of diagnosis, don't feel like they have the time in their practice to make the diagnosis and to deal with the consequences of that diagnosis. So a lot of people still buy into that old perspective that this is just the part of aging, there's nothing you can do for it. And yet now we know there are many different conditions that show up at some point as a dementia. Some of them have risk factors that can be reduced because of better diet, better exercise, universal education. And so I think that over time, and especially if there is the advent of some effective medications, this nihilism will decrease, and medical school healthcare education will improve, and people will get a better sense of what is possible to be done.
Wonderful, thank you. And I think we have time for one more question. And maybe Barbara, you can answer this one. How do you determine Alzheimer's Los Angeles legislative priorities?
Great, thank you for that question. It's a great question. So we really try, we are a local organization, so we are committed to being responsive to our community. So one of the first places we start is with our care counselors. What are they seeing coming through? What are families being challenged by? And then we also have within our organization a public policy committee, which is made up of members of our board and members of the community who have engaged with our organization in some way over time and have an interest in the work that we do. We always have a seat on our public policy committee for someone who is living with the disease and their caregiver, because that it's absolutely essential that the policy priorities and legislative work that we spend our time on is responsive to what they are telling us is most important to them. So with that input from our staff and from our public policy committee, we sift through what is possible for us to achieve. Because we do have to be realistic as well. We know we're not going to get, $2 million from the state to do a new program, but maybe there's a different way that we can get to the same end. And so we're always looking for those ways that we can create a legislative policy priority that actually results in a positive change that our families can see, feel, and touch.
Wonderful, thank you so much. It seems like we've come to the end of our time together, so I just wanted to again thank Dr. Cherry and Barbara for joining this afternoon, and for all of you in the audience for being a part of this. If there are any other topics or themes or ideas that you'd like to learn about, please reach out to us. Like I mentioned, this is the first time we've done a speaker series, but we'd love to do more and have your input in future topics. If you do have any other questions, please send them to us, and we will make sure to send a recording of today's presentation as well as the slides with all of the links that are included. Our contact information was up, but please visit our website for additional information on how to get involved with advocacy, public policy, or even just information on caregiving for your loved ones. Thank you again so much for joining us. We hope you have a wonderful afternoon, and we'll be around for a couple more minutes if anyone has any other questions. Thank you so much for joining Alzheimer's Los Angeles. Have a great day. Thank you, Barbara and Deborah. I'm gonna read to you some of the remarks. So they're saying thank you for the speakers. Thank you all, stay safe. Very informative, such valuable information. So good feedback.